All right, so I'm here today with a special guest, a true healthcare hero, frontline worker, registered nurse, Jasmin Smith. How you doing today, Jasmin?
I'm good. How are you?
I'm fantastic, can't complain. Before we get started, I just want to say a very special thank you to all of our frontline workers, all our healthcare workers for all the work that they've put in to make things safer for us. And I really appreciate everything that you guys have been doing, and I'm sure everyone in the city appreciates it as well. But yeah, let's get right into it. So for me, when I take it back to about November, December, I think that was the first time I heard the words COVID. And I saw it on the news, and I saw that it was something happening in China, something about a lady eating a bat. And I wasn't too concerned. I was just like, okay, there's some stuff going on in China. They'll take care of it. Doesn't really affect my life. Then boom, next thing I know, the NBA season is getting canceled, and I'm like, oh, like this is real, like this is actually happening. So that was my, I guess I don't want to say COVID moment, but that was the moment that it really became real for me. So I want to flip that question to you. What was the moment,
Mhm.
or when did you realize that this is a serious thing?
Well, honestly the same. Like in December when it was like strictly in China, it wasn't even in North America yet. Like I was like, oh, whatever. Like I didn't really think much about it. And then when when they announced everything was canceled, like NHL and NBA, that's when I was like, oh, like this could be bad. And like I was thinking that because my parents were away in Arizona traveling and they were out of service for like 5 days. So they had no idea
Oh,
about anything. And I finally talked to them and I was like, you guys, like the NBA is canceled, the NHL is canceled, they want to cancel school, like they're going to close the border. Like that was my moment when I was like, oh, like this could be bad. And
yeah.
then I almost feel like naive saying that. And I was sitting on on a night shift with a coworker and she was like, I'm so scared. Like what could happen? Like what if it comes here? Like what's going to happen? And I was like, well, it's not here and
Yeah.
we don't know anything about it. So like I didn't even think anything about it really
Yeah.
until the media kind of took it.
Yeah,
So
I feel like that was like most people, we all kind of heard about it initially. Even friends that I talked to, they said, oh, it's just like the media being the media, trying to scare us or whatever the case is. But yeah, I feel like it was a rude awakening and a fast awakening for a lot of us. But let's talk about what your experience has been like throughout this time as a nurse working in a hospital.
um it's been like everything. Like I don't know. Like I've cried. I've had my breakdown about it. All of my friends that are nurses, like we're all like, oh my God, like what is happening? But like thankfully, like I don't work in the ICU. I don't work in like a long-term care center where it's like been really bad, but like you still get hit with the changes. Like we get like maybe 5 emails a day minimum about cases and like policy changes and all of these things that you now have to incorporate into your daily practice, let alone like having the potential to care for someone that's diagnosed positive. So it's just been like for me, like I really have to just show up to work and just be like ready for whatever. And like whatever the vibe on the unit is, like depending on who you're working with and how they feel, like your team can affect how you go about your day too, because we all feel like all the emotions
Yeah.
with it. So it's hard to like put on a face and just like go about your day when things are always changing.
Yeah.
So
So what's
it's been
the
really
atmosphere and the energy been like, as you guys have made adjustments coming into work every day?
mhm. Well, for me specifically, and this has been in the news, but I work labor and delivery at South Health, and we actually closed down about a month and a half ago ish to potentially become a COVID ward. And so then we were redeployed to all the other hospitals to work instead. And I do work like another job at another unit right now. So like I kind of had that to fall back on, but like, you know, you can't, it's hard to imagine like picking up your work life and going to another unit and getting used to another team and how they do things. So, and like, let alone our patient population that have birth plans and they want to deliver at South Health, but now they have to commute to another hospital and you have to have a baby in the middle of a pandemic. Like, you know, like it's just like crazy. So that was a big change because like we had no idea what was going to happen, but thankfully we are opening up again at the beginning of June. And that's solely because the case projections were not as bad as they were like thinking how bad it could get in Canada. So thank goodness for that. And they built that giant tent at PLC to basically open up more beds for people that would need to be hospitalized. But again, that hasn't been used, thank goodness. And then the argument from that is going to be like, oh, like we're just wasting healthcare dollars, like all this money, blah, blah, blah. But it's like, you had to, like we saw what happened in China and Italy, like you can't take the chance, like we don't have enough beds. Nowhere does.
Yeah, for sure. Yeah, no, I definitely agree with that. You got to, you just have to play it safe, you know, prepare for the worst and then hope for the best. But how's life at home been like for you? Have you had to distance yourself from your family? Have you had to take extra precautions? Let's get into that a little bit.
Yeah, so actually, like I mentioned, my parents were traveling in the US. Long story short, they cut their trip short and came home because of like border closures and a whole bunch of national parks in the US closed, so they couldn't even go the way they wanted to. So when they came home, I talked with them and we were saying, you know what, like because I'm a nurse, like I shouldn't live with them for like to come home. They need to isolate for the 2 weeks because they were in the US. So I lived with my friend Mullen for the 2 weeks when my parents got home, and I still went to work. Like I talked to my friend and I was like, Mullen, like, are you comfortable with me living in your house? Like, even though like I work in the hospital and whatever. And we talked about it and like, we agreed that it was fine. And maybe the story would have been different if I was like caring for more people that tested positive. And I don't know exactly what I would have done if that was the case, but everyone I cared for tested negative. So that's good. So that kind of changed that. Like that was kind of crazy, but it was also really nice to have a friend to live with for 2 weeks while also working when it was like still kind of like a new thing and the whole quarantine just became really real in the city. So it was nice to have a friend to be around that like was not in healthcare, to be honest, because that's all you talk about now. Like it's what you see on the news, on the radio, like it's everywhere. So I had someone to like, just like, it was like a distraction, basically. And like, otherwise, like, you know, like people can make the jokes, oh, like if I get COVID, it's going to be from you because you're a nurse. And I was like, if I'm spreading COVID to people, then there's something wrong with me because am I not washing my hands enough or am I not washing them properly? Because really I should not be spreading it to people I'm around.
Yeah, for sure.
But otherwise, I don't know. I feel like my relationships are fine. Like they've definitely been tested in some ways, like with distancing, like you can't hang out with people anymore. Like, you know, like I don't hang out with anyone really, except for my friend Mullen, because I've been living with her and I've been around her since. So
you're still living with your friend Mullen? You haven't?
I'm not. I'm home now, but I kind of just like we talked about it. We like when we did hang out after that, we were like, and still like we're very socially distant, and like we're not like cuddling each other and like getting really close. But I don't know. Like she was in my circle from day one, and it's like even with restrictions lifting I feel like you can choose your circle, but choose it very wisely. Like, don't go hang out with like 3 other people.
Yeah.
Like, have your one friend and continue to hang out with them. And if you want to see your other friends, then stay 6 feet from them if you can.
Or hop on a Zoom call. Yeah, that works too.
Exactly. Yeah.
So in your wildest dreams as a nurse, did you ever imagine a situation like this happening? Because I just imagine that every nurse or every person in the healthcare industry kind of has like a worst case scenario or like a doomsday scenario. Was this it for you, or you just never saw something like this, actually happening?
I didn't think I would work through a pandemic. Like, I really didn't. And like, people can say that, oh, you're a frontliner, like you signed up for this. It's like, no one signs up to work in a pandemic and have your work life completely switched around. And that goes for anyone, like people getting laid off and, going through it in their own way. But I really didn't think that I would live to see something like this. And like, thinking about it now, I feel like that was naive of me, like, really. I'm sure something like this would have happened at some point in my lifetime, but maybe I just didn't think it would be now. Like, I have like 4 years of nursing under my belt, so that's soon. Yeah. That's early in my career to experience it, but
yeah, for sure.
Here we are.
Yeah, for sure. So do you feel like hospitals were adequately prepared for something like this, or everyone was just blindsided and had to make last minute adjustments?
I think that Canada was prepared only because we got to see how it impacted other parts of the world. And for that, we're very lucky. Yeah. I wonder how it would have been if this started in Canada.
Yeah.
And like, even still to this day, like, things change at the hospital every day. Like, we all get screened before we enter our units. Like, do you have any symptoms? You obviously haven't traveled. We used to do temperature checks. So I feel like because of that, we were prepared, but also we're lucky because it's not as bad as they thought.
Yeah.
Like, I did my research, but like, on our government website, like, it tells you that like the initial models for even Alberta alone, by mid-May, so probably like right now and into June, if it was really bad, they were predicting 700 cases in hospital and 250 in the ICU at a time.
Yeah.
But the top number of cases that were in a hospital at a time was 90, with 20 in an ICU. And that was at the beginning of May. Yeah. So our peak happened earlier.
Yeah.
But yeah.
So do you feel like,
it's not that bad?
Because what I've heard from some people is that, obviously not from everybody, but some people are saying that maybe we made it out to be too much of a big deal, or, it wasn't as serious as the media made it out to be. But then there's also other people that are saying that the numbers aren't as bad because we properly social distanced. So what do you believe it is? Do you believe the numbers were a little stretched out and far-fetched, or has the social distancing actually worked and curbed the numbers?
I think that social distancing worked and curbed the numbers. Like, we definitely did something right, and you can see it like in the numbers, like it shows. If we were, like I said, like, say Canada was the first to get hit with COVID, I feel like that could be different, because you're dealing with an unknown virus.
Yeah.
And it's not like the precautions are not like put in late, but you're working as fast as you can in that sense. Yeah. So it's hard. Yeah. But I feel like the projections were right, and you have to prepare for that regardless. Like, people may think we spent a whole bunch of money to prepare for something, and it wasn't that bad. Thank God. And here we are. Like, what if we were in a lockdown for a month and you couldn't leave your house? Yeah. Like, it wasn't, the media kind of made it a little worse, but here we are. and
Yeah,
it's not that bad
for
as
sure.
it could have been.
I mean,
So
yeah, at the end of the day, that's what matters, is that the situation is improving, numbers are going down, and they're slowly easing regulations. But
yeah.
as regulations are easing up, I know a lot of people have thrown around like second wave. They say that there's more to come. So, what advice would you have for people as they're reintegrating back into society in order to still practice safe tips and to
Mhm.
avoid a situation where we have to go back and lock down again?
Yeah. So first, I want to say that I don't work for the World Health Organization. I don't work for the CDC, so don't take my word as like the be all end all. Like, this is just what I think and
Yeah,
what I support, and everyone needs to do what they think is best. However, I think that social distancing will be around for a long time. I don't like COVID's never going to go away. Like, this is going to be like this is a new flu. We just need to learn how to like I don't know if we'll eradicate it, but we need to control it. Whether a vaccine comes or, our cases die down, there's no new cases and whatnot, whatever. But I think social distancing will be around for a while. I think that will continue to affect businesses the way that it already has. And I think that people should be wise in choosing, again, like who they want to be in their circle. Like, can you go hang out with a few friends in a backyard and enjoy your summer? Absolutely. Should you be going to a party with 20 people and all of these 20 people are coming from places with their own environments, their own social circles? They are in their, like, everyone goes to different places in a day.
yeah,
So the contact you have, you can control, so I just think that people need to be smart.
yeah.
And I feel like there will be a second wave, and if we act like Toronto acted, it'll be bad.
How did
But if
Toronto act?
we well there's there's all these pictures and videos of like all these people in the park, like crowds, like herds of
Wow,
people, and there's no social distancing at
wow,
all.
wow.
And like, that's all it takes. Like, it doesn't matter if you're not sick. Like, you can carry a respiratory droplet on your hand and pass it to someone else simply by touching like the same thing. So everyone plays a part in it no matter what,
Yeah,
in my opinion.
yeah. So you feel like moving forward, we're just gonna have to adjust to a new normal, because you said that COVID will kind of be like, like the new flu, and we just have to adjust to it. I know a lot of people they're still wearing masks when they go outside. Do you think that's something that's gonna have to be, eventually mandatory or necessary, or you see that carrying on for a long time?
I think that it will, I think it'll carry on probably for the rest of the year. And I'm for that. But people need to understand that if you wear a mask, whether it be like a surgical mask or a cloth mask, it is not to protect you. It is to protect other people. So if everyone is wearing a mask in Costco, you're all protecting each other, because you can, like, you're still breathing in air from the sides of the mask.
Yeah,
Like, it's not,
yeah,
so if we kind of all do our part as a society and protect each other, then I'm all for masks.
yeah.
If I see one more person wearing a mask in their car alone, I can't with that. And the gloves, I can't with the gloves. I'm sorry. I don't know, like, oh my God. That could be another podcast in itself. We don't
Yeah, we'll save that for
I
another
don't
time. Yeah. I feel like what contributes to that. I feel like what contributes to that is there's a lot of misinformation going on out there, and because everybody is like is deeming themselves as an expert. You can go on Facebook and so said this, or go on Instagram and you see so and so said that. And one thing that I've been hearing a lot is a lot of different conspiracy theories. I don't know if you've dove into that too much, but conspiracy theories about how it originated, what the ultimate plan for this is. Like I've heard like the Bill Gates theory that, he's behind all of this. And I've heard that they're trying to make vaccines mandatory so they can put like microchips in our system and, a whole bunch of crazy stuff. I just want to hear what your thoughts are on all that when you hear that stuff. Is there any sort of validity to it? Is there like a part of you that kind of believes it or not at all?
I mean, my non-professional self is like, Kim Jong-un did it, 100%. Guy faked his death in the surgery and now he's back and he's 30 something and he got like bypass. Kim Jong did it. No, the conspiracies, like I don't know them enough to like tell you one from like A to Z.
Okay, fair enough.
But like people are always, I don't know, I feel like in our society, like we're always looking for like the next thing.
Yeah.
Or like we're looking for someone to like fuck up. Mm-hmm. And then that's what you talk about until we get bored of it. And then we're looking for the next thing. Like if you want to read about ingesting bleach because Trump told you to, be my guest. To each their own. But like, I don't know, this like science doesn't lie. Like this virus is real regardless of how it got here, but it's real. Yeah. And like the way it works inside the body is scary. And that's why we're living the way we're living right now. Yeah. So whoever did it, whether it be a human or a bat, this exists. And yeah, it's ruined our year, but this is reality and we have to deal with it if we want to, move on.
Definitely. Definitely. I agree with you 100%. So to wrap this up, I always want to end on a high note, end with some words of positivity. So just wondering if you have words for the city of Calgary, the nation of Canada, anybody listening right now. Yeah.
I think that we all play a part and it doesn't matter what that part is, but as long as you can look at this situation in a way that what you do is for the better and for the good of not only yourself, but those around you, then we'll get through this. I don't need people to, continue to applaud frontliners and, do all this stuff. I think that everyone should be included in that. And like, again, we all play a part. And as long as we can do that and come together, then yeah, we'll be able to get there. It's just going to take some time.
For sure. Awesome. Well, yeah, this has been a great time, Jasmin. I really appreciate you coming on and sharing some insight, sharing some words of encouragement. We'll have to catch up with you again another time.
Sounds good. Thanks for having me.
All right. Take care.